The meeting will start in about 4 minutes. The meeting will start in about 3 minutes. The meeting will begin in about 2 minutes. The meeting will begin in about 1 minute. All right, Tracy, you can hear me all. I have 2 o'clock. If you'd like to get us started.
All right, good afternoon. Thank you all for joining us today for our December the 30th COVID-19 update across the Lake Cumberland District. Dr. Wayman and Mr. Crabtree and Stuart Stillman here that will be answering some questions that have been submitted over the past 2 weeks. I do want to remind you that if you do have questions as we walk through the meeting, please put those in the chat box and we will answer those questions. Tom, I'm going to turn it over to you and let you share an update.
All right. Tracy, you were cutting out on my end. You may need to get closer to your mic, or you may have it covered or something. Just check that out. So as far as our update, we've had 1,273 total cases in Adair County today, 45 deceased, 1,188 released, leaving 40 active. Of those, 37 are isolated and 3 are in the hospital. Right now in Adair County, our 7-day incidence rate is 29.76. So they're still in the red zone, which would be at 25 cases average per day per 100,000. So there's at 29.76. Casey has had a total of 877 cases as of last night. These are our totals as of last night. 27 of those have deceased, 819 have been released, leaving 31 active. Of those, 28 are isolated and 3 are in the hospital. Casey right now is in the orange range of community spread, the only county in our district that has dropped out of the red. They're at 23.87, 7-day average incidence or cases per 100,000. That could be simply because we had the Christmas holidays and no one really tested on Christmas Eve or Christmas Day, so those 2 days get counted as zeros. KC may go right back into the red within a day or two, but anyway, we're happy for the positive news, and we hope that their case rate stays low. That could be or probably is a contributing factor. Tracy, are you hearing me okay, by the way?
I am, yes.
All right. Clinton has 869 total cases. 20 of those have deceased, 760 released, 89 remain active, 79 isolated, 10 in the hospital. That's a 7-day average incidence rate of 125.83 cases per 100,000. Cumberland's have 416 total cases, 6 deaths, 385 released, leaving 25 active, 24 isolated, 1 in the hospital. They have a 47.52 7-day average incidence rate or new cases per 100,000. Green has had 802 total cases, 12 deceased, 748 released, leaving 42 active. 39 is isolated, 3 in the hospital. Their 7-day average incidence rate is 57.45. Aquarius had a total of 1,131 total cases, 8 deaths, 1,000 released, leaving 123 active, 114 of those isolated, 9 in the hospital. Their 7-day average incidence rate is presently 78.76. Pulaski's had 3,797 total cases, 60 have deceased, 3,480 have been released, leaving 257 active, 242 isolated, 15 in the hospital. Their 7-day average incidence rate is 60.02. Russell has had a total of 1,129 total cases, 34 deaths, 1,045 has been released, 50 remain active, 49 isolated, 1 in the hospital. Their 7-day average incident is 37.46 or 37.46 average new cases per 100,000. Taylor's have 1,124 total cases, 20 have deceased, 1,598 have been released, leaving 106 active, 102 of those isolated, 4 in the hospital. Their 7-day average incidence 51.56. And finally, Wayne, 1,403 total cases, 17 deaths, 1,208 released, leaving 178 active, 167 of those isolated, 11 in the hospital. District-wide, 13,421 cases, and 249 of those have deceased, 12,231 have been released, leaving 941 active cases. Of those, 881 are isolated and 60 are in the hospital. As of yesterday, the state testing positivity rate is 8.41. That means about 8.5 people out of every 100 that get a test, the test comes back positive. Also, we keep a little chart here that shows how fast it takes to get to different levels of thousands. So back in December, we achieved, it took us 6 days to get from 8,000 to 9,000 cases. Then it took 5 days to get to from 9,000 to 10,000, 5 more days to get from 10,000 to 11,000, and now it's started to spread out a little bit. 6 days to get from 11,000 to 12,000, and 9 days to get from 12,000 to 13,000. Now that sounds good, but right immediately after the holidays, we had a couple of days where we didn't have a lot of testing and stuff. It may speed back up again. So it wouldn't surprise me to see us over the next couple of weeks to see that go back up. I guess the big news, Tracy, is we've started getting some vaccine in. If there's not vaccine open to the general public right now, but the health department got some vaccine for to give to healthcare and healthcare related workers. We got 1,200 doses for our district. We moved I think 80% of our vaccine on the first day, and now we're down to maybe just a handful here and there of vaccines. Hospitals also got some vaccine. They vaccinated their own employees, or in the process of doing so, and also helped vaccinate some healthcare workers and other healthcare folks in the community. The federal government got a contract with Walgreens and CVS to vaccinate the long-term care facilities, faculties and residents, or staff and residents. And they're in the process of doing that. I expect that should be wrapped up by the end of January. So that's exciting. We don't know exactly when we're going to get a bunch more vaccine in, but that's off to a pretty good start. So thank you all for tuning in.
All right, so I'm going to start with the questions. Can you hear me okay, Sean? Okay, first question. Why does Lake Cumberland District Health Department list on the daily information schools as a source when there have been no instruction classes for some time? The person that asked this question is a school employee and wanted to know how is that possible?
Okay, well, I list that information on a couple places on our website. One is on the Daily Brief. I just list the top 4 areas, and then on our main statistics page, that's on a donut chart. The thing you have to remember is all of those categories are very broad. The school category includes universities, it includes K through 12, it includes private schools, Christian schools, it includes technical schools and vocational schools, it includes faculty, staff, and students. And, you know, mostly what people are thinking about is the K through 12 public schools, but it's a lot broader category than that. And even when kids are receiving at-home instruction, there's still certain events going on at the school, such as sports or sports practices, where kids are having to take assignments and drop them off or pick up things. So there's lots of ways this can still be tied to schools. So I hope that answers the question.
Thank you, Sean. Next question is about vaccine. And you just shared that we received some doses. So several questions regarding vaccine, group 1A, 1B. Why don't you share just a general update about vaccines across Lake Cumberland and how that's going to impact us in the future?
Okay. I covered this a little bit in the introduction. Of course, you know, everyone's really interested in where can I get the vaccine and how quick can I get it. And the thing everyone needs to keep in mind, there's been 2 companies so far approved to put this vaccine out, at least in the United States, maybe in the whole world. Do you know, Dr. Wayman, just 2 or?
A third vaccine has just been approved, the Oxford one. But I know that won't be approved here until the trials are done in the United States.
Okay, so there's one more company that's got vaccine being released in certain parts of the world, but not in the United States yet. So anyway, these companies are trying to ramp up enough vaccine for the entire world, and that's going to take quite a while. So we were fortunate to have enough vaccine for this phase 1A, which was hospital staff, medical-related staff, and most importantly, the long-term care patients and or residents and staff. We know that the residents of long-term care is the most likely group to end up hospitalized and to pass away. So that's certainly a really important group to take care of early. We also know that we need to keep our medical infrastructure up and going. So that's the 1A. As I said earlier, the federal government has contracted with CVS and Walgreens to vaccinate the nursing homes in our area. The nursing home, every nursing home in our area has made contact with CVS and Walgreens. As far as I know, they all have dates scheduled, and if I'm correct, that should all be done by the end of January. So that's rolling out. And as I said earlier, the hospitals have received vaccine to vaccinate their own employees and have helped us some with the community employees in some of the counties. Now, as far as phase 1B, the federal definition of 1B was extremely large. It included a very large number of people. So at the state level, 1B is going to be kind of subdivided up. And as of yesterday, the state was defining 1B, or what we might call 1B1 or 1BA, or the first subsection of 1B as first responders like fire, police, school staff, and those that are 70 plus. And the latest information that I saw was that, there wasn't an expectation that that would begin until toward the end of January or the 1st of February. A lot of it depends on how quickly we get the vaccine and how quickly we move through the, getting the hospital staff, nursing homes, medical staff done. And in our district, we had done a lot of pre-planning, and we were able to get through the phase 1A very, very quickly. There's other parts of the state that's really struggling getting through all of their 1A group. So, I will stay in touch with the state every day to try to see how that's going. But I'm not sure when they will release vaccine to start the 1B. I just don't know. I know people want the answers to that stuff, but we just don't have those answers right now. Might be an opportune time, Tracy, to let Dr. Wayman speak for a moment about vaccine safety. You want to touch on that, Dr. Wayman?
So besides the side effects that we learned about in the trials, which are basically the usual kinds of side effects, sore arm, aches, fatigue, headaches, maybe fever, the only other one that's severe is anaphylaxis, which is basically a very bad allergic reaction. The Moderna one has only had one documented in the media, which means the CDC probably received that, and we as a health department may have had one as well. Both those people are doing well. So out of approximately 1 million doses already given in the United States, there have only been about a handful of episodes of anaphylaxis, all of which have been treated appropriately. I just did a little study of our own in the health department, and the only side effects that we've had mostly have been a sore arm. We have had a handful of people who've actually had flu-like symptoms, which is fever, body aches, tiredness, and that's it. So I think these vaccines are very safe as far as we know so far.
And when you get a fever or body aches, that's just a sign that your body is reacting to the vaccine like it is supposed to.
Yeah.
Okay, so that sounds good. Tracy, you might want to mention, Tracy, or I'm mentioning it, I guess, since I'm doing it. Anyone wants to type a question into the chat, it would be a good time to do so. We didn't have a lot of questions today. We're going to have one more. And before we get into that, Stuart, do you have anything you want to add to anything we've talked about?
Can I just add something?
Sure.
This vaccine is not a live vaccine. It does not have a virus in it. It cannot give you the disease. So anyone who's immunocompromised can get it without any problems.
Yeah. And as far as our planning goes, according to both the state 1B criteria and the federal 1B criteria, we have already started pre-planning all of that. We're already reaching out to schools. We're already reaching out to other groups assigned as essential workers. We're reaching out to first responders. We're getting everything lined up so that, just like with this first batch, we didn't even know we were getting vaccine on one day. No one was scheduled. The next day we got it, and we moved 80% of it, the next day, because we had pre-planned and we had things lined up. And we're going to do that for phase 1B too. What we will have to decide though with the 70 plus, if we get less vaccine delivered to our district than we have, people who are 70 plus that want it, we'll have to figure out how we're going to work through that. If it's going to be a first come, first serve, or a, call in for an appointment system, or, we kind of got to work that out. But we're a few days away from that, but by the time we get there, we'll have something worked out. Stuart, do you have anything to add? Say anything?
Just a thought before you know, did we vaccinate all of our 1A people across our 10 counties? Those categories?
Have we done?
Yes. Are they all vaccinated?
It's all in the works, Tracy. We've pretty much gotten out everything that we have. The hospitals are in the process of vaccinating their employees. They didn't want to do all of their employees at once in case that, the employees felt bad and needed to stay home for a day for having a strong reaction to the vaccine. So they were kind of staggering their, the day, how many staff got it each day. So they're going to be wrapping that up over the next few days. I can't say we did every medical related person because not every medical related person signed up to get the vaccine. Some people opted out. I think we had, probably close to 40 or 50% that agreed to take it, maybe more. I'm guessing at one point that's kind of where we were. I know that interest now is picking up more, that we're getting it, and people are seeing that folks are taking it and doing okay. We're getting a lot more interest in the vaccine, more interest than we have vaccine. But we're pretty much through it. The nursing homes are in 1A, and the CVS and Walgreens is working through that with the local long-term care. So we're well on the track. We've moved what we have, and the hospitals have moved a lot of what they have. So
That's wonderful news. Okay, I'm sorry. Go ahead, Stuart.
All I was going to say was just to reiterate what Dr. Wayman said. I mean, when we are able to contact you for a vaccine, or somebody is, please go take it. Most of the people on this call, if not all of us, as healthcare workers in that class, have had our vaccine, and you can see that we're sitting here and we're fine. So.
Thank you, Stuart. I have another question, Sean.
all right.
How many, if any, of the Macquarie County active COVID cases are nursing home or prison related?
Okay, so right now we have 123. We have 123 active cases that are in Macquarie County, and 46 of those cases are jail or prison, which in Macquarie County it would be the federal prison because we don't have a jail there. So that would be 37% of our positive cases right now are tied to a substantial cluster happening at the federal prison. 18 right now are residential, or at 15%. Now that's not exact numbers. That's counting, if you're an employee of a nursing home or of the federal prison and you have it, you wouldn't count in that category as, you wouldn't count as prison, you would count as home isolated. If you're an employee of a residential place and you have it, you wouldn't count as residential, you'd count as home isolated. So it may be just slightly higher than the numbers I just gave you if we're talking about every one inmate, resident, or staff member, but it's a significant number. Unfortunately, for our jails and for our other long-term care facilities, residential related facilities, I would say that about half of our of these types of facilities in our district did a really, really good job, either keeping COVID out of their facility, or if it came in, keeping it very contained. But with this last spike that we've been experiencing the last 3 to 4 weeks, it's pretty much got into all of them. The thing is, the employees, they leave, they go home. They're not kept at the facility isolated and unable. So the employees leave. And if you've got 20 or 25 employees that work at a place, and there's a tremendous amount of community spread, all you need is one employee to get exposed to bring it into one of those facilities and for it to spread very quickly. So unfortunately, and it's very sad to me that, you know, now vaccines are starting to become available for these types of facilities, and man, I wish we could have, as citizens, you know, just for, you know, 4 or 5 more weeks, have been, you know, way more vigilant on avoiding crowds and wearing our masks, and, you know, really being careful. It's so sad that right up here, when the vaccine's starting to go into these places, they all got hit. They all got hit so hard. So it's just sad. I wish we, as a society, could have done better, but you know.
So just a thought, since you said that, Sean, since we're giving the vaccine out now,
I'm having trouble hearing you, Tracy.
can you hear me? Am I good?
Not so good.
All right. Am I better now?
Yeah, maybe. What about you, Stuart? Is she cutting in and out on you? Okay. Am I? Oh, we're doing tech support as we go. We're at different locations, so. Tracy, you might just have to get in close.
Okay, let's see now if I'm better.
Oh, yeah, there you go.
Okay, so a thought about our mask, wearing a mask, and maybe this is a Dr. Wayman question, or just to share some information. We're getting the vaccine out there, so what about wearing masks now, Dr. Wayman?
Well, the problem is that not enough people have had the vaccine. They've only had 1 dose of a 2-dose series. Not everybody's going to mount a great immune response after the first dose. So I think everybody needs to continue to wear a mask to try and protect themselves and their families.
Is the verdict out yet that, you know, once you get the vaccine, you may not get sick from it, but can you still have it and be spreading it even though you're not getting sick from it?
That is the consensus, although it's really hard to do those kind of studies, but yes, so far they haven't found that people get infected asymptomatically and therefore spread it. I mean, the whole point of the vaccine is to stop the infection, but the jury's out.
Yeah.
You have to have a bit of experience with infections after the vaccine.
Yeah, it gets tricky. You know, you want to see wide community compliance with distancing and masking up until we, you know, feel like this disease is largely defeated, meaning that, you know, a lot of the population has been vaccinated. So, you know, the question would be, if I've had the vaccine, is it absolutely essential I mask? You know, maybe not, but it's going to be so hard to tell. You know, it'll be so confusing if part of people are masked and part of them are not. You know, how would you ever keep up with it? So, you know, I expect the federal and state government will continue to encourage people to wear masks and social distance until they've declared that the disease is largely defeated, would be my guess.
And also that also means if you've been vaccinated at this stage and have been exposed to a case, you will be quarantined for the same reasons.
Yeah.
We don't know if you have enough immunity to fight that infection.
Yeah. So it's you get the first dose, and then 4 weeks later you get the second dose.
That's true for the Moderna, and it's 3 weeks for the Pfizer. Now the hospitals are giving the Pfizer, and we are giving the Moderna.
Okay. So then it's about 10 days after the second dose where you've got that 98% or 95%. So, you know, you're still, after you get the first dose, so you're about 5 or 6 weeks away from having the strong resistance that you want. Well, 4 to 5 weeks, I guess.
Dr. Wayman, there was a report today. I don't know if you've seen that or not, but this is something that just runs exactly in what you're saying right now. a person in California, I guess a healthcare worker who's taken the vaccine, 8 days later has become positive for COVID. And I guess maybe two things play into that. One, you're not totally immune yet. And two, if you've been exposed somewhere in there and you're starting your symptoms, you can, it takes a while for the vaccine to work.
Correct. So they were probably infected about the same time as they got the vaccine. So the vaccine didn't have time to do its job to mount a response to fight the COVID they've been exposed to.
There's a question in the chat box that says, was you going to read that, Tracy?
It may be the same question, I'm not sure. Did it ask about Dr. Wayman?
I can't hear Tracy, so maybe you can read it.
You got to lean up there, Tracy. Get into it.
Are you going to ask it or you want me to? Dr. Wayman, can you talk about the new strain of COVID-19? Will the vaccination be effective for that?
Yes, I can. So everything we know about it so far is that there have been several places on the spike protein, which is the corona part of the virus, which attaches to the receptors, which then allow the virus to enter the cell, have been changed. So there are a few little alterations on that spike protein. That is not enough at this point to change the virus enough to make the vaccine useless. So all the scientists, all the experts at this time think this vaccine will be just fine. If there are major mutations and major changes, then we may have to change the vaccine. And they will have to tweak that. Now that will take a few weeks to get that organized, and then of course the production line of making more vaccine. So we hope we don't get any major changes.
All right. And Tracy, there was another question in the chat box asking when and where would someone's 94-year-old father be able to receive the vaccine? He has cabin fever and needs to get out. So, the answer is we just don't know yet. We know in phase 1B, the first level of phase 1B, according to what the state is saying, is going to include school staff, first responders, and those 70 plus. So your father will be in the next priority group, but it all depends on when, enough vaccine gets into our area to begin giving it. And so, I just don't know. I don't know when that will happen. It may be very frustrating if we've got 6,000 folks in our district that are over 70 and we're getting in vaccine at 200 doses a pop or whatever. It's going to be difficult to I don't know, it'll be frustrating, but we'll do the best we can. It's a high demand product and we're going to have more demand than we have supply, and we will try to be as fair with everyone as we can be, getting it out. So I don't know. It's a tough situation. It's like I said, these companies are trying to make enough of this vaccine for the whole globe, and that's a tough thing to do. I don't know, Stuart, Dr. Wayman, you have any additional information than that? That's what I've got so far.
That's all. Yep.
Yeah. I'm hopeful by the time that they start getting it to these big populations like this that, maybe they can start getting out to more providers, like, the, pharmacists and doctors. So you can just make an appointment at a variety of places. But, I don't know that will happen either. I mean, there's a lot we just got to figure out as we go. On the positive side, remember with this first one, we didn't have any patients scheduled or any vaccine on one day, and on the next day we got it, and we got 80% of our vaccine out immediately. So we don't sit on this stuff. As of a few minutes ago, we've got almost all of our vaccine given out to, the target group that was in 1A, the medical community. So we're not sitting on our vaccine, that's for sure.
And just so people know, I mean, we don't know how much will be sent to us. We have no idea of that. We knew a couple of days before that we were going to get the vaccine, a number, but even then we weren't sure what that number would be until we had it in hand. And we only knew one day before we were going to actually receive it. So,
and then we weren't even 100% sure it was going to come in the next day. Now it did, but
right.
So.
Are there any other questions, Sean, in the chat box?
No, I don't see any more in the chat. It's a good time to tell people to get their flu vaccine. And it's a good time to tell people to continue to mask and social distance. I can't tell you how many clusters we have in our district, a lot that's tied back to family Thanksgiving meals and family Christmas meals. A tremendous amount of our, new cases that aren't tied to, specifically a jail or a nursing home. A big chunk of them were tied to these holiday events. So we would really encourage you for New Year's Eve, don't get out and be around a lot of people. It's just not the right time to be doing that. Things may look a whole lot different, in the spring and summer as we've got a lot more people vaccinated and so forth, but we're not there yet.
We can still see spikes potentially from the holidays or from any other things. I mean, some activities like basketball games are starting for high school. We just want everybody, if you would just be patient, we are right on the cusp of being able to vaccinate. Now that 70 and older group, it may be a couple of weeks, 3 weeks down the road from now, but we are so close. If you could, we went this far, just stay patient just a little longer.
All right, Dr. White,
Let's
you got
see,
any final thoughts?
There is some more questions in the chat, Tracy.
Okay, I'm sorry. You want to read those?
I will. If someone has an allergic, and if someone has any allergies to meds or food, do they need to still get the vaccine or stay away from it? That is something that has been asked of me several times. So that's Dr. Wayman.
So the recommendations are that if you're allergic to anything, you should remain in the clinic for longer than other people when you receive the vaccine, because we don't know the answer to that question. Most people who've had allergies have not had any issues with anaphylaxis so far. Now, if you have allergies to any of the ingredients of the vaccine, then obviously you shouldn't receive it. Or if you had anaphylaxis to a previous dose of that vaccine, you shouldn't receive it. So no, if you have general allergies, you can take the vaccine. Just be wary. Every clinic has epinephrine in case somebody does have an anaphylactic response.
Yeah. So someone that doesn't have any issues, we ask them to hang around for 15 minutes to make sure they're going to be okay. And someone that's, there's any suspicion there could be potentially some sort of issue, we ask them to hang around for 30 minutes, I think.
At least, yes.
At least 30 minutes. So you just might be asked to stay around the clinic longer to make sure you're going to be okay. All right. And there's no more questions unless one pops in, Tracy. So
I do have one question for Dr. Wayman that I've been asked, and I don't know the answer to it. If someone they're on medication for like rheumatoid arthritis or anything like that, so the medication that would lower your immunity, is there anything out there on people like that?
So because this is not a live viral vaccine and it does not have virus inside it, it cannot pose a problem to somebody who's immunosuppressed for any reason. So cancer therapy or immune therapy for autoimmune disease, which lower your immune system, will not cause any problems. What it can do is if you are immunosuppressed, then you may not respond to the vaccine as well as somebody who's got a good immune response. But a little bit of immunity is better than no immunity. So anybody who's immunosuppressed for any reason should get the vaccine.
Dr. Wayman, there's another question in the chat saying if you have a sulfa allergy, would that be a problem?
No, there's no sulfur in there, to my knowledge.
No sulfa. All right, so sulfa's fine. Okay, I think that's it. Tracy?
All right, nobody has any other thoughts, final thoughts?
Happy New Year.
Yes.
Happy New Year.
A happy COVID-free New Year.
Our staff will be taking off New Year's Eve and New Year's Day. We're largely caught up with our work, and we're going to take those 2 days off. Also, a lot of the labs will close those 2 days also, so we won't be doing a daily brief on our website the next couple of days. And the staff have worked really hard since March. They need a little breather. But we'll come back next Monday. Of course, we'll have some staff working over the weekend doing investigations and tracing. And we'll all come back Monday ready to continue the fight. Looking for, it feels good to be on the offense, to be vaccinating people, which I guess vaccinating is technically a defensive thing, but it's more offensive than just doing contact tracing and case investigation and trying to enforce, masking and distancing. So it's a more proactive step. I'm glad we're there. If not there as much as we want to be, we're at least starting the fight. So it feels good to be making that transition. Happy New Year, everyone.
Happy New Year. Thank you all for joining us, and we will be back January the 13th at 2 o'clock I think it's the 13th is the date, but in 2 weeks. If you have questions, please send those in to us. Excuse me. Thank you all. You all have a good day. Bye.
Mm-hmm.